This is our podiatry requisition form with Advanced Pathology Solutions. We want to make sure that you fill out your patient information and your ordering physician, and also the billing information. It's easier to attach the billing information cards to the back, make a copy for us, than actually filling this part out. That's what makes it a little bit easier to do on everybody. Okay, on the APS requisition form on the clinical information, we want to make sure that you check which type of tissue that you're sending in the bottle, and also make a note you'll be provided some 20 ml bottles and also some 40 ml bottles, 40s or 60s, depending on what kind of surgeries you're going to perform. And you want to make sure that you label the patient's name, the date, the specimen type, the doctor, and the date of birth. The specimen type will also be listed here on the requisition form and checked what part it is. And just make sure that if you have a smaller specimen that will fit in here and cover itself in formalin, you can use a 20 mils. But if you have a bigger specimen, like this for example, it needs more formalin. Just make sure that you don't leave any tissue out of formalin. You'll need a bigger bottle. Once you label out what kind of specimen it is, and then also too, you have a specimen 1 and a specimen 2, you can just label 1 and 2 on the top of the lids or on the side of the bottle. And then if you would check for us what side it's from, it's for the right foot or the left foot on that specimen 1 or specimen 2, the same thing. Also, what we like for y'all to do is if it's from the bottom of the foot, if you just take an ink pen and mark what part of the foot it's from, or for example if it's on the ankle on the right foot, put some mark right there. That way you can correspond the biopsy with the spot that's taken off of. On a nail unit, on all of our cases for nail, we run a PAS acid shifts. It's always recommended. If you would just check that for us. Now, nail cases do not go inside of formalin. You'll be provided a small specimen bag, and if you would just take your nail specimens from your dry keratin, put them in the bag, seal it up. Then with a Sharpie on the outside of the bag, if you would just put on there left foot or right foot and what digit it was from. If you do have a nail specimen, and once you have it labeled, what we like to do for these is once you have the patient requisition form filled out with the billing information attached to the back, we like to just take the biohazard bag, stick it to the front, and staple it all together. And then you can fold these up, and you can ship as many as you need to, all in there together. And then you'll be provided some bigger biohazard bags. And you can just stack those in there as many as you have. Once you get these all sealed up, you can add them to the rest of your specimens and put them in our clinical pack. Once you get your specimens all together and your requisition form filled out, then we can ship it. What we do is, since your bottle's in here, they're ready to go, and you have the requisition form that matches the patient, there's a pocket in the back of the bag. You just place that in as so. So each patient you have will have its own separate bag. So when they get to the laboratory, we can pull it out and we can line them up as they go in numerical order. Now once they get in the bag, there's two things that we do. We have a FedEx Express box and a FedEx clinical pack. OSHA requires a two-way barrier to ship supplies. One is the biohazard bag, 2 is the clinical pack. So if you have 10 of these, you can put 10 different ones or more in each bag. Get all those in there as many as you can, and then you just seal this package up. Once this package is sealed up, you then will place this in one of the FedEx boxes. Go ahead and close the box up. Remove the adhesive seal and seal the box. So once you get the box sealed up, then you'll take the APS FedEx shipping form. It's already been prepaid. All the information's filled out. The only thing you have to do is put the date and your company information. and it will get to APS lab the next morning by 10:30, which is priority overnight. And the labels are self-adhesive. You just pull the tab off, stick it on the box, and this will be your copy. So you'll have it. Keep that for your records, and then call FedEx, and then they'll come and pick it up.